Raman, the question always keeps on hitting our mind is why COVID pandemic is taking such a long time to wean off, because usually a viral endemic disappears within a year or two. So what are the various reasons why it is taking such a long time?
There's some of the reasons which become important is one, the viral factors. The virus tends to mutate very rapidly being a RNA virus. The second factor is we developed vaccines very rapidly, and therefore the virus had another challenge for fighting against immune pressure. And we provided a fodder on it by ensuring that not everybody who was eligible to receive vaccine, they received the vaccines. Whether you talk at a different country level or whatever, in geographical areas also. And the third thing, now we have added an armamentarium related to medicines. To my mind, is all these together is going to put pressure on the virus to mutate. The virus is RNA virus, and therefore this pressure is actually leading to more mutations that are occurring. And the reason why we should be optimistic that it may not persist for a long period of time is the coverages are improving, and there is some kind of the variation that we had in management also has got reduced to a larger extent, and people have been exposed to natural infection all across. So to my mind, we are in a safer zone as of now, but the virus will continue to fight, and it has already, if I can put, now this is a pure speculation, it has saturated places where it can mutate. So now to think in terms of newer mutation occurring in spike protein is going to be a little difficult.
Dr. Suresh, will Omicron be the last variant of SARS-CoV-2? And are we heading for the beginning of the end of COVID-19 pandemic, or there's a danger of another bad global wave of pandemic in future? Dr. Suresh, please.
Yes, sir. Thanks for asking the question. It's a very difficult question to answer. But the problem is Omicron is not the last one, sir. The Omicron, the virus is going to mutate there. I agree with Dr. Speaker. Enough mutations happen on the surface proteins, enough mutations happen, but still, this is an RNA virus, and still a lot of people are not infected or not vaccinated. Both things is possible right now. So a lot of space is there for a virus to still mutate. Only thing, the dangerous mutations or variant that is emerging, like a Delta variant, that's only our concern there. So definitely it's going to mutate. Omicron is not the last variant to me. It is going to mutate. Apart from COVID, all respiratory viruses, for example, the H1N1 influenza and avian flu, all our chances of coming back with a mutation is possible. So there is no end. One of the beautiful editorial written there, the pandemic is not going to over. Pandemic keep happening, and whether the same virus, what time it is going to happen, whether the same virus, that's a difficult thing to predict, but definitely pandemic is not going to over for me. Some other new variant or some other new RNA virus or some other viruses can come back to us. How, when, at what extent, we need to wait and watch.
Dr. Singh, what are peculiar features of Omicron BF7 variant, and does it have the potential to infect even those who are vaccinated in the past, as happened in our country? Dr. Singh, please.
Yeah, sir, this is a very relevant question you have asked, that if you see that this variant BF.7, that is the present, it is said that in China, this is creating the havoc. The RO of that virus, this BF7 is said to be vary between 10 to 12. This is a quite high reproduction number, as you are saying, but the Omicron variant, which I think the last January we suffered here in India, that was only, the RO was only 5. So in that way, it is very difficult that whether whatever the news you are getting is science based or not, I don't know. But definitely it appears that the transmission rate of this new variant is quite high in China. But as Dr. Raman has already explained the reason for that, when this China has a zero COVID lockdown policy, that natural immunity was lacking in Chinese population, and even their vaccine efficacy was not good. In that way, somehow this has created more havoc and more transmission has occurred. And but still, what the internal news is coming, that even in China, the death rate is not so much as far as my information is there. Uh, it is definitely the virulence is there, but most of the people are getting, I think, by 4 or 5 days natural treatment they are taking, simple treatment and getting well. So in that way, this was the one reason. Suppose the same virus of this reproduction number of 10 or 12 comes to India, still I feel that our person, because this has been clearly shown that whether you have taken a Covishield or Covaxin, both has neutralizing capacity against the Omicron variants, whatever it may be. It may be B7 or XX, XBB, whatever it may be. It has been some studies have clearly shown a very good neutralizing capacity of our vaccines. So our only thing which Dr. Raman was also stressing is the boostering. Only 26% or 27% third boosters have been taken. The reasons are quite obvious. I think you know that when this COVID epidemic came, we had a fear. When this fear went away, we all became something. We were in the mind that this epidemic has now vanished from the India. But my prediction is that as the other experts in India are saying, that in that way, our immunity is quite high at present due to the hybrid immunity. We have got the natural immunity we have got from the vaccines, and our vaccination rate is quite high. You know, it is more than 220 crores. So more than 90% people are vaccinated. At least they have taken second dose. So in that way, our vaccine will neutralize the variants at present now, and that's why we will not see a peak at all. And this panic is quite useless. Rather, the media has fueled a very difficult panic. I don't see any rationality for that. My message is that, well, only in the crowded place you should use mask. Otherwise, in my opinion, there is no need of universal masking at present. There is no need of any lockdown. With the life should continue as it is going on. Thank you, sir.
Dr. Raman, the big nuance for COVID-19 in our country is, should India start nasal vaccine at least to the high-risk groups like the frontline workers, the immune deficient patients, and patients with comorbidities? What is your viewpoint on this? Or we should wait?
Government has already announced that it will be made available through private sector as the third dose, which would be entered into COVID. It has also said that it will also be made available in certain government sites, but it's going to take about 3 weeks time, about sometime around third week of January, this vaccine would be made available. The bigger issue that is going to come, as you rightly say, that should this not be used to provide it to healthcare workers, those who are at higher risk. Most of them may have taken boosters. Now the fourth dose is not so far allowed as the discussions from NTAGI have gone. I think it is time that associations like IMA, API, they should represent that at least healthcare workers should be allowed to take the vaccine. If this vaccine is not going to be made available in shops, to purchase and take the vial, that's likely to become difficult for healthcare workers. So I think we need to represent that at least for them, taking that vaccine would be useful. Because this
Raman,
is
sir, can I ask one question here? That lots of people are asking that if you take a fourth dose as a booster, what is the phenomenon of antibody sinking? So some study definitely has now shown that if you take more and more booster, it is not going to help at all. So do you don't think that the third booster was quite okay?
Third booster is fine, but this is mucosal immunity. What this vaccine is going to provide is mucosal immunity. if you provide fourth dose to an individual, which is an injection-based dose, whichever vaccine you take, it is very clearly shown that the protection against infection drops down by duration very quickly. No, it would perhaps protect an individual from new infections only for a period of up to 2 months, but the protection against the T cell responses has not been studied in any of these vaccines, vaccine trials per se, over a longer period of time. And naturally, you find that it's very difficult to answer that question. If as an individual I was to opine, I would say that if you have trained your T cells for 3 times is more than sufficient for it to keep in its memory as to how to fight with this particular infection. But this particular phenomena becomes different for mucosal immunity. For mucosal immunity, you need to provide the drops, nasal drops, so that local immunity is built in.
So, Dr. Raman, does it mean that it will eliminate the development of carriers, the nasal vaccine, unlike the injectable vaccines?
Absolutely, absolutely.
So,
Because
Dr. Yes, please.
it has SIGA kind of a response. It's mucosal immunity that we are talking about. So it doesn't allow the virus. It neutralizes the virus before it enters into the body. Because this
Sir,
is
Dr. Raman,
immunity.
sir, the data which we showed with this nasal vaccine, do you think it is sufficient to prescribe or to tell our public?
I cannot lie. It is still not sufficient. This is a reality of life. We should actually wait for efficacy related data. But the catch there is one simple, that if protection after, you have to give 2 dosages of nasal vaccine 28 days apart. Protection tends to come after 42 days. So which essentially means that if there is any outbreak that tends to come, we'll have lesser time to develop immune responses against it, especially nasal vaccine related immune response. And therefore, that worry tends to keep on coming, whether we should wait or do whatever. In any case, these vaccines are unlikely to cause any major problem because these are also based on adenovirus vector, which comes from chimpanzee. As it was Covishield, it was used in Covishield. It's just that the type is different. This is 36, adenovirus 36. Nothing beyond that. But still, there is no efficacy data. We are in the same situation as we were in 2020, when the vaccines were approved without phase 3 data. And first, they were to be provided to healthcare workers and frontline workers. So those question marks and questions would continue to remain there, sir.
Sir, one question I'm seeing the chat box by Dr. S.K. Gupta, how early will mucosal immunity wane off, or say how long will nasal vaccine protect?
We don't know that part, because this is first global vaccine for which we don't have even efficacy data. So duration of protection is still unknown. But there is something which happens. If you get small protection also through sensitization, every time when you will be exposed to this virus, it itself will ensure that the mucosal immunity will get a boost.
Dr. Suresh, if a new wave comes in India, do you have any anticipation, any particular part of India will be worst affected? Last time we had Maharashtra very badly affected, Delhi very badly affected. Any anticipation or any ideas regarding this?
Usually major metros will always face a heat of any new variants. Any major metros, if you see either Chennai or whether it's Hyderabad or Delhi or Maharashtra, usually Delhi, Maharashtra is vulnerable, but most of the metros is vulnerable to any variant because of the overcrowdedness and migrant population. And particularly migrant population, the vaccination is not great. So usually when overcrowded, migrant population is present, the chances of eating particular part is always present. And regarding the nasal mucosal immunity, what the people are asking about, this is not a live attenuated strain. For example, influenza, we are using live attenuated strain that produces better mucosal immunity. This is not a live attenuated one, since it's again equal to killed only there. We are not sure how much the mucosal immunity is going to last, but when the wave like what China is facing, it's going to hit India. That point of time, the 2 months immunity, people are looking at it. Most of the healthcare workers is calling me, can I take the 4th dose of it or not? That's the questions, $1 million questions. But if the wave comes and the wave intensity is much higher, we are going to see the patients in the wave. We need to have some immunity for next 2 months or 3 months. People are thinking only the short-term immunity to overcome the wave. That point of time, we need to take the vaccinations. Ideally, intranasal is better because it has got no contraindications. Ideally, compared to injectable, we need to change the route of entry and see whether the immunity is much better. Naturally, some mucosal immunity can prevent the entry of the viruses. But what we are looking at it, not the infections I'm looking at to prevent. I'm looking at the seriousness or severity. The patient should not hospitalize. The patient should not go to the ventilator. That immunity has got better. So you can take the 3rd dose or 4th dose, definitely that got boosted, particularly people elderly, comorbid conditions. If you take the vaccinations that prevent the death, that prevent the hospitalizations, particularly ICU stay and ventilator. So that's what we are looking at it. We don't look at the infections prevention there. That's not possible. Infection prevention has not happened. If you see the US data, people taken 4 doses of vaccinations, but still people are getting infected. So it won't prevent the infections, only prevent the seriousness and death.
Dr. Singh, how is the current Omicron variant infection different from the previous strain?
Sir, actually, this question we have not the current Omicron in India is we not experienced this, but I think the symptoms are the same in the China also, the same way the sore throat, the upper respiratory tract infections. Still, it is not penetrating to the lungs in most of the cases. So I think the symptoms are almost same. Only thing that the rate of transmission is quite high. Otherwise, the things are same. Or very aptly, Dr. Raman has told about the management part also that only this some data which we at present find useful is with the Paxlovid. Otherwise, this other drugs and other monoclonal antibody that had already failed. So only thing that the symptomatic management is needed, nothing more than that. So I don't think it is very different from the Chinese symptoms which we are getting information or what was in the India. So it is almost same, sir.
Dr. Raman, other thing which keeps on bothering us that why Omicron is mutating so fast, and is it a remote possibility that the new variant may be more dangerous?
No, that possibility, as I said, is extremely remote when it comes to adding to virulence, to my mind. Because if we have had almost 3 years with this virus, but you find that the changes are essentially occurring in spike protein or receptor binding domain per se. And therefore, that may not remain as a stronger theoretical possibility to my mind. And as I said, the main reason why perhaps Omicron is changing is this virus is mutating faster is because it's a RNA virus, and on top of it, we have provided vaccines, and the vaccination could not be provided to 100% of the people. So you have people who are not vaccinated, partially vaccinated, and vaccinated. So you provide a fodder for this virus. Differing challenges bring out differing responses per se. There is one small thing which I would prefer to talk about. When you provide vaccine through nose, it doesn't only mean that there will be increase in mucosal immunity alone. When the virus is attacked, you will find there are certain antigen presenting cells which take those antigens inside the body and ensure that there are systemic responses that occur. Even T-cell sensitization tends to occur through that. So taking nasal vaccine doesn't mean that it will only provide local immunity. It adds to the immunity that tends to exist even in T-cells per se.
Sir, 2 questions in the chat box, 2 or 3, sir. Dr. Manoria, sir, with your permission.
Yes,
Dr. S.K. Puda is asking why this chat box 1 failed. S1 research work has shown that this Chadox one failed as a nasal vaccine, but BB4154 is working. Both are based on the same technology. So could be any reason, sir, for that? Or and second question is the under pressure of BF7 that government has approved BB4154 as booster while the trial is very limited. So I think you have already explained that. Yeah, and the third that I am Gopichan, can a person who has not taken third dose take nasal vaccine now? Please clarify. This is an important question, sir. Dr. Raman, sir.
This is
Yeah, ideally, you want protection at both the ends, no? Whether the protection is in terms of protecting from hospitalization or severe disease and also from infection, because if you get infected only, then the issue related to hospitalization may come up. So as a third dose, if one was to think, if one was to prioritize, no, the first could be use of nasal vaccine, second could be any heterologous vaccine. No, especially, I still don't see Novavax. To my mind, Novavax was a better vaccine compared to the others that have been approved. We don't know enough about Corbevax. Though Corbevax has been approved, we still don't see the efficacy related data. You may just take a heterologous vaccine, and if nothing is available, perhaps homologous vaccine is also good enough for any vulnerable person. Because if the new virus is to come, if it is likely to emerge in China, it is likely to emerge in a very short period of time, because their wave is going to last for a short period. You have to imagine that the rise of new infections is going to be so sharp, and at the base, if you look, I would think that it will take maximally 6 to 8 weeks time to see that the Omicron wave which we are seeing in China will subside compared to 5 months that they had. And the longer the virus faces the challenge, the higher is the likelihood of development of variants. But if the variants develop within 4 to 6 weeks time, then one's worry would be, have I taken my protection of a vaccine, whatever is available? And that would perhaps will have to be answered by taking what is available at that point.
Dr. Manoria, I have a question with Dr. Gunga Khedkar.
Yes, sir.
yes.
Is it possible that, BF.7 will behave differently in China and differently in India? Or
No, sir. So far, what we have learned is more than 600 different variants have emerged out of these corona SARS-CoV-2. But they are not far different. No? So in different geographies. You will find in geographies, whatever feature it had, it continued to remain the same. So it is unlikely that what would be seen in China would be different than what one would see in India.
so what is the report of BF.7 severity, or how it affects the mortality, etc. in China?
It's very low. No, in terms of virulence, it has not gained in virulence, but it has gained in transmission efficiency.
So why there is so much of hype?
That I don't know, sir.
The huge
Sir,
population is
BF.7, if you actually look at other countries, you look at USA, BF.7 survived for a short duration of time. It was already, the other variants took over in terms of percentages. And this is a convergent evolution. So it will be like, if I was to give a simple example, you will see variant A to Z at any given point in time in different proportions in different countries. But BF.7 disappeared quickly all across the world, except China being reporting as of now. But if I were to answer very simply, China, if it is not submitting its own data, then how do I infer BF.7 is going to predominate in China? We have no idea.
But
those were earlier reports.
But the lay press, if you see, and is full of BF.7 as if it is an atom bomb and it will destroy the whole country.
Yeah.
Hey, sir, BF.7 is actually belonging to the sublineage of BF.5. We had BA.2 and BA.5 infections commonly occurring during Omicron wave. So there is a protection that tends to be there even at this point in time. I'll give a simpler reasoning. Now, if you actually see the entire COVID pandemic, currently you have the bivalent vaccine. But otherwise, all the vaccines were based in Wuhan virus sequence or isolated Wuhan virus per se. And if you actually see, over a period of time, though variants came up, these vaccines continued to be protective, or the variants did not have the ability to increase the virulence. There is no reason to believe that if I have received BA.5 infection as a natural infection, I may not be as well protected against what is being reported. But it becomes very difficult. I think part of the thing is it becomes difficult to explain in public. So people misinterpret, people draw their own conclusion. It becomes difficult.
Yeah, you cannot control that. I agree with you.
Sir, Dr.
Suresh,
Mahadev Desai has raised a very valid point that this BF7 is already in India for over 2 months, but has not
2
caused
months.
large number of cases. Is it not a good sign? I think definitely this virus was present, and not only in India, in many parts of the world, but it had caused any havoc in other parts of the world. It is happening only with the China. And Dr. Gopi Chand again asked that my doubt has not been answered. He was clubbed with other questions. So he was asking that who has taken third dose, then take nasal vaccine now. I think that there is some news from this higher authority that you cannot take nasal vaccine as a fourth dose booster due to the antibody sync phenomena. Dr. Raman, can you please explain that again?
Sir, these are guidelines that have come from NTAGI, that Movin app will not allow you to take fourth dose.
Yeah.
If you have already taken 3, fourth dose, and therefore I was saying it is a question that IMA, API, all of them together should try to resolve if the efficacy sounds as good. Now, with respect to BF.7, whether it was present in India, it was reported in September 2022.
Yeah.
The better part of it is the proportion did not increase. So what it essentially means is it did not have survival advantage compared to the other variants that were there. So we should not worry as much about BF.7. But as I say, in the lay press also, it becomes very difficult to explain. And today what has happened is all COVID publications, they are freely accessible to any person. Now they are open to interpretation by any person. Whoever is powerful in communication, perhaps those messages will go, whether they are right or wrong.
A couple of
Dr.
questions.
Suresh,
Dr. Raman, before I asked to answer your questions, I asked Raman, Dr. Raman, BF7 we know it is not going to cause a big havoc in India, but our concern is XBB 1.5. Right now, the New York and New Jersey that is facing a problem right now. The numbers is going up, hospitalization is going up with XBB. The problem, US is not like China. They got opened up previously itself, not like they're opening up now. And US population, most of the people are taken 4 doses of vaccinations. Despite 4 doses, despite mRNA, despite bivalent vaccinations, XBB numbers is slightly going up in people with elder age group. That is a concern. Now XBB is spreading from New York, New Jersey to the neighboring states also. If you follow closely the US data, that is a concern. Whether the XBB and BF7 meets what's the new variant is going to come. That's a concern for us. Again, XBB also behaving like a Omicron only. It is not causing any serious disease for people in US. People who are above the age of 60 or people who got comorbid, again, the hospitalization is going up in that particular scenario only. So XBB is a real concern, particularly XBB 1.5 is a serious concern for us. because XBB1 and 1.1 seen in Singapore, not a major problem. But XBB 1.5 is a concern because right now New York and New Jersey is facing the problem spreading to the remaining districts. That's a concern for us. Whether XBB 1.5, is there any role in India?
No, as I said, no, I would perhaps differ a little bit. When it comes to elderly population in US, the booster dosages coverage is low, very low, no, compared to other places. No, as we assume, no, third and fourth dose being taken, it's taken by other population, but not elderly population. That's one. Second thing, would this come and challenge us? Yes, it could. There is no doubt on that. But the challenge is not likely to be higher in terms of the stress that it can put on healthcare infrastructure or individual outcomes, because it's not going to increase the risk of death, the risk of hospitalization. Risk of hospitalization in elderly population is mainly related to vaccine coverage with boosters. And therefore, as I say, people don't, so we should try to promote people to take the third dose, which is currently neglected by the population, at least among those who are vulnerable.
Dr. Suresh, the other issue is nasal vaccine is very easy to use. So what is your viewpoint? Should it be made available over the counter so that everybody can use easily, or should be mediated only through the government hospitals and the private hospitals?
This is not the usage pattern, sir. We need to know the records, whether we are vaccinated, how many times. That international agency should correlate whether we need 3 doses, whether we need 4 doses or something. That is why they're working on COVID portal. But number of cases goes up, government can modify the COVID portal and allow the 4th dose for definitely for healthcare workers. Number of cases goes up, that's not a big deal. But at this point of time, whether we can allow it to the private sector, for example, across the counter or over the counter, whether I can use it or not, that we need to decide whether the government wants that data. For example, somebody can't take the data without entry and without any proper certification. In future, people will ask, I have taken 4 doses, means there is no proof. That's only concern. That's only for logistic reasons and certification reasons. Otherwise, it's easy to administer. There is no contraindications, I told earlier. Only patient who's got anaphylaxis to these medications, they are contraindicated. Otherwise, for example, live attenuated vaccines of influenza, contraindicated in immunocompromised host. This vaccine is not contraindicated in immunocompromised also. Anybody can take, there is no absolute contraindications. So only thing, allergic reaction to the components is only contraindications for this vaccine. The certification issue is a problem. That's one thing. One question came up in the chat box asking about the PCR can pick up this variant. Definitely PCR can pick up. This is not like yes drop or something there. Our PCR can pick up this variant. There's no doubt about it.
Dr. Raman, is there any way we can stop the new variant from mutating?
Not at all. Not at this stage of the pandemic, because there are so many variations. No? Whether it is vaccine coverage, whether it is the medicines that they use, whether there is rational use of medicines, and individual variations in terms of following COVID appropriate behavior, protecting oneself with vaccines, no, to ensure that you don't get hospitalized. I think mutations will happen, but as long as these mutations don't increase the severity, I think we are in the safer zone, and there is no reason to believe that that probability that severity may increase is significantly high. So I would still assume that things should go as we would dream to, and we should be happy.
I think all of us have enjoyed the discussions. The audience has also very much enjoyed the discussion, and we have learned a lot of things. So over to Dr. Sangram, brother.
Thank you, sir. It was a wonderful panel discussion. There are a few more questions, 1 or 2. I think Dr. Suresh can quickly answer.
Saw this thing, they are asking about the doses or the vaccinations. Doses is 2 doses at 28 days gap. The speaker clearly alluded. Availability and challenges. Bharat Biotech has got good manufacturing capacity. It can increase its availability. If time allows that, they can produce a lot of doses. That's not a big challenge for the Bharat Biotech because they got good manufacturing capacity. Definitely the availability is not a challenge, but only one manufacturer compared to Covishield and Covaxin, but they got a manufacturing capacity is there. So if need arises, yes, they can definitely manufacture a lot, and we don't export the thing, we can have sufficient doses also. That's fine. That's not an issue. Most of the people already taken 2 doses, only booster shot. So only 1 shot is required. So the doses is not a concern. RT-PCR I already answered, and couple of questions already answered by a speaker there. So any other questions, Dr. Singh? Yes. I have not seen anything unanswered in the chat box.
Yeah, there is one question from Dr. S.K. Gupta. Question of BPV 154 is availability of doses, not the indication.
That's what the doses I told. 2 doses for a person who have not taken the vaccine, 2 doses at 28 days gap. People who have taken a dose, it's a booster dose, only 1 shot is fine.
And there was one more thing now, question of this oral remdesivir drug.
Just now, NEGM has got publications today only there.
Yeah.
Show the sequel there. So people who want to read more, update the NEGM today's editions, you can go and read about it. It is good.
Yeah, Dr. Singh was discussing about it. Any comments about Dr. Oral remdesivir, Dr. Singh? Unmute. Kindly unmute.
Unmute and
Unmute.
please unmute.
At present, we don't have enough evidence for that at present. So I think it is under trial. So let us hope if it becomes available, it will be a very good thing. But at present, there is neither is it available, not it is going if something new wave comes at that time, which is not going to come at all.
Yeah, before we conclude, we'll have one key takeaway from each. What is your key takeaway message, Dr. Raman Gangekar?
Don't panic. Believe in common things happening commonly. This infection should be moving towards endemicity pretty soon. Though endemicity would mean different things to different people. What we should take in our mind is we should not lower our guards completely.
Thank you, sir. Dr. Suresh?
Microbes are always intelligent than us, so don't underestimate your enemy always. Keep a watch on your enemy and get a mask. Get a mask because don't underestimate your enemy always. It's a fight between the microbe and us, so don't underestimate your enemy. Wear a mask. Like a mask, people keep on asking about it, particularly crowded places, closed spaces, hospital settings. I need masks there. People need to know whether I need to wear a mask or not. 10 days back is a big deal, but still we need to wear a mask in a closed encounter to prevent not only this Omicron, but even for TB and influenza and all other viruses, I need mask.
Thank you. Dr. Singh?
But one simple thing that it is heavily raining at China. Just keep the umbrella ready. There is no need to use this point of time. Thank you.
Thank you. Manoria, sir?
Looking at the current evidence, we are hopeful that the new variant will not produce a serious disease in our country.